Right, good morning everybody. Hello? Right, we've no microphones this morning. We booked a PA system and it's not turned up. So I am going to have to shout, which is, can you hear me at the back? It's not panto season yet, but I'm going to try and project and do all that stuff. I'm Mike Wilde, I'm the Chief Exec of Macc. Welcome to the Irish World Heritage Centre. It's lovely to see so many familiar faces, projects from all across the city, so thank you for coming and getting through all that traffic. I'm sure most of you have had to navigate this morning. Today's event is really just mostly about people meeting each other. There's a mix of dozens of voluntary projects all working in the field of mental health here, because you've all got the grant. There's people from Manchester Health and Care Commissioning, there's people from the NHS, the City Council, lots and lots of people here. So the whole point of today really is to mingle. You know, this is a great networking opportunity. But the other thing that we wanted to do is, because we're halfway through, we're going to hear from OPM, who you'll all be familiar with as doing the evaluation, about what they've picked up so far. So this is a really good opportunity to find out about what's working, what we're learning, what the result of all your work is already telling us about mental health in this city. So I'm not going to say any more than that, because I think that's probably all you need to hear from me, other than the housekeeping bit. So, fire exits are green signs. I think that one's probably the easiest, because it takes you straight outside. Unless there's smoke coming from there in the event of a fire, I'd suggest we all use that one. Toilets are out that way and on the left. There's no fire alarms or anything planned, and we are going to be, of course, because we need to do monitoring and evaluation as well, we're going to take photographs. We're actually webcasting this first bit so other people can watch and find out what's going on. If I wave at them now, you'll hear a roar of waving back about 2 minutes later, going all the way around Manchester, because it's on a delay. And that's about it, really. So I'm delighted we can welcome Dr. Philip Burns, who's the Chair of Manchester Health and Care Commissioning. So over to you, Philip.
So can everyone hear me? Yeah? Good. Okay. So my name's Philip Burns. I'm a GP in South Manchester in Northern Moor. Anyone know what Northern Moor is? Good. So there's a northern bit of Wythenshawe. And I've been a GP there for, I think it's 14 years now. And before that, a GP in Liverpool for 10 years. So the mental health issues that affect our population and the people I see every day, are very prominent. And that's something that we all see every day in every GP practice in Manchester.
Sorry to interrupt, but if you're supposed to be videoed, it doesn't look like you're in the frame.
No? Okay.
I was trying to catch Jack's. I'll tell you what, you stay there for
Good directing.
Do you see me now?
Yeah.
Okay, good. So from April this year, I took the chair of Manchester Health and Care Commissioning, which is a bit of a mouthful, I know, and all Manchester Health and Care Commissioning is the three CCGs, we change our names every about 5 to 10 years, and so the previous incarnations were FHSAs, PCTs, CCGs, and now Manchester Health and Care Commissioning. But what's different is the three CCGs come together in one organisation in partnership with the City Council, because we think we can do things more effectively if we think about health and social care as care and not separate them too much. So that's the way in which we're working going forwards. One of the major strategies for Manchester is the Our Manchester strategy. Who in the room is familiar with the Our Manchester strategy? Good, it's percolating through. I think there's a lot more work to do there. But this is the asset-based approach to making the most of everything we have in the city. So many of the organisations represented today are a very important part of those assets, in addition to all of the voluntary groups, individual carers, the contributions that individuals make across our cities. It's a really important part, and important to build upon that. One of the it's sometimes difficult to to see Our Manchester strategy sort of personified, but one thing that brought it home for me is a poster that you might have seen in the city centre and around the city, and it says, because it does put the responsibility onto individuals as well, it says, who's responsible for litter in our city? And it says you are, because some of us must have dropped it at some point. And it's thinking about what we can contribute to our city, to make it a better place, and that's it in all aspects, in health and social care, and just from simple things like not dropping litter. So the city is changing as well. So Manchester is thriving. Lots of people are moving to Manchester. I believe it was voted the best place to work in 2017. I believe it's a good place to work if you can find work. But what that's doing is bringing new people into our city, and the population is expected to grow by 100,000 people in the next 10 years. So there's going to be even more challenges going forward in order to provide good quality health and care services for that population. So we need some innovative ways of delivering services. We need to draw upon all the assets of the city, and that's why we're very keen to support many of the projects such as this that are represented in this room, and put some of our money behind that as well, because that money goes a long way, as I'm sure we'll hear in the evaluation. So why do we fund this project? Mental health and well-being is a particular priority because it's such a prevalent problem within Manchester and in many cities like Manchester. So every day in my practice, you read different statistics, but it's estimated that at least 2/3 of the people presenting will have a psychological aspect to their presentation, because it's not just mental health never exists alone. It's always in conjunction with other physical health problems and also related to social health as well. So about 2/3 of the people that we each GP sees every day will have at least some psychological aspect to their health and care that we need to address. But we also recognise that many people are not getting the service that they need or not getting it quick enough. So we are putting more investment into mental health in order that situation can improve. In particular, the IAP services that we know haven't been responsive enough in the past. And I see that every day. I want to get prompt access for my patients who need counselling and psychological therapies so that doesn't deteriorate. So we can address problems early and build strategies for that individual to manage their mental health. But it is the whole system that needs to work together. It isn't just about clinical services. So we've got to be very creative and think about different ways in which we can work with community and voluntary organisations to get the most bang for our money, because the money isn't getting any better. The Chancellor announced a little bit more for us yesterday, but we've got to remember that the costs of care are accelerating far faster than that, so we want to get as much as we can for the money that we have. So it's about a year on now since we launched the programme. We're going to hear from OPM later about the work they've done on the evaluation so far, but the main purpose of the day is to hear from you and hear from each other and exchange views and make contacts and think about how we can learn from each other in delivering and developing the service. On behalf of MHCC, I'd really like to thank for all the great work that you've done and you continue to do. It's really inspiring to see all the different projects coming to fruition. We have a staff buddy for each project within the Manchester Health and Care Commissioning. I'm the staff buddy for Soho City. I've just been off with a broken arm, so I was meant to go and see the project, but I will be going to see that soon and learn more about it. So, but different staff members will link to you, and hopefully you've established that link as well. But it is really inspiring to see what can be achieved. Good mental health is about much more than clinical care. It's about being physically active. It's about having a good network of friends and supports and activities to do, and it's a very broad approach to improving the mental health for everyone in the city. I'd also like to thank Macc for the support of the programme as well. Unfortunately, I can't stay for the whole event, but I hope you'll have a really exciting morning and early afternoon, which is very enlightening for everybody involved, and with lots of sharing.
Thank you, Philip, and thank you for joining us in the middle of a busy schedule, as well as being GP, of course. That's the thing we always forget about some of these meetings, is all the GPs that come along also have to go and do the doctoring bit as well. Yeah, great to have you with us, and just sort of on behalf of Macc, we'd like to say we're really, really glad to be able to deliver this sort of project. We love giving out other people's money, is one way of looking at it, but also we love helping show what our sector's capable of when we bring everybody together and get some investment into the sector, something that we struggle with in some other arenas, which we're all familiar with. Main event now is to hear what OPM have got to tell us. So I'll let you go and introduce yourselves and your roles. And I'll make sure you're on camera.
Great, lovely. We're just having a bit of a Mission Impossible moment, as we've had about 40 seconds before the projector was going to turn off. So you might have seen us just run over there. So hello everyone, nice to see you all. Great to see so many people here today. My name's Tara McMillan. I'm Project Director of the Evaluation of the Mental Health Grants Programme, and I'm joined today by my colleague Tim Bidey, who many of you will have been in touch with over email and over the phone, who's the Project Manager of the evaluation. And we're really excited today to take this opportunity to be able to share some of the emerging impacts and learning that's coming out through the evaluation as we're reaching this sort of 1 year in stage. So really keen to be able to share that learning with you today. So essentially, in terms of the programme itself, the programme has 3 core aims. The first is around increasing social inclusion for those individuals with serious and enduring mental health conditions within their local neighbourhoods. The second is around increasing the take-up of IAP services for those that find those services difficult to access. The third is around increasing levels of support for people with mental health conditions within their local neighbourhoods. And essentially the evaluation at its core is all about understanding to what extent the funded projects have been able to support each of these 3 programme aims. In addition to that, the evaluation is trying to demonstrate and explore wider learning about mental health service delivery, evidence projects. It's also trying to produce information and evidence, robust evidence, to inform commissioning of mental health services going forward. And equally trying to demonstrate the wider learning around networking and close working between grant-funded projects and the statutory sector, CCGs, etc. So the evaluation, as I mentioned, we're about 1 year in. It's been running since November 2016 and will run until January 2019. And what we're presenting today is essentially feedback from a number of evaluation monitoring forms. Projects in the room will be familiar with these, which are essentially self-assessment forms which projects have completed, monitoring their ability to engage people locally, thinking about the outcomes which they're observing, people which they've supported, and thinking more broadly about some of the learning and key successes and challenges faced in administering the programme. So I'm going to hand over now to Tim, who's going to talk you through a little bit about some of what we're hearing from the funded projects and some of our learning in the evaluation to date.
Okay, so I wanted to start out today by perhaps just giving a flavour of what's been happening so far and all the activities that the projects in the room have been delivering. So there are 35 projects funded through this grant programme, and at the point that the 3-month monitoring forms were submitted, over 800 people had been engaged across Manchester. And when we talk about people, we're talking about a lot of different groups. We're talking about both younger and older people, men and women. We're talking about Black, Asian and minority ethnic communities, the LGBT community, and also smaller communities such as hospital patients and carers. I think what's really striking about the grant programme so far is how the funded projects, you in the room, are approaching the programme aims through just a complete diversity of different activities. And for the purpose of today, we've kind of grouped these into 3 overlapping areas to give you a quick overview of everything that's happening. So the first of these groups is support. When I say support, funded projects are offering a range of regular support services, including face-to-face counselling sessions and other forms of therapy, online and offline peer support, including befriending schemes, and non-clinical drop-in groups that provide a consistent, accessible form of mental wellbeing support. And under this grouping of support, projects are also offering more ad hoc forms of support, such as helping people through referral processes, through training key individuals in the local community or organisation staff members. Also offering specialist support, such as mental wellbeing assessments, employability needs assessments, debt advice and advocacy support. And there's even projects helping people to help each other through a time banking scheme. And some projects have also reported running events to increase people's awareness of the services that are available to them in their local community. So, for example, one project reported delivering an introductory session in partnership with an IACT provider, which not only explained IACT services and their importance, but also the specialist services that BAME groups could access. The second area of activity is training, and this really is what it says on the tin. And this is projects offering training workshops across a variety of disciplines. So anything from woodworking to gardening, radio production, social enterprise work, participating in project activities. And that really is kind of social contact at its most basic. It's people actually leaving their house and just seeing more people on a day-to-day basis. One project reported that for one of their service users, their project activities was his only regular means of social contact because he didn't have any friends or family in the local area. It's good to see someone nodding. The second way in which this was apparent was that there were also many examples of projects where people were meeting new people and forming new social relationships. And this was being seen in the sense that actually participants were beginning to meet up with each other outside of projects. So there was a more kind of concrete social relationship being fostered there. And the third way is that some projects reported that service users were beginning to become more involved in their local community as well. So going to more local community events, perhaps popping down to their local community centre, or expressing a desire to start volunteering in the local community, or at the 3-month point actually starting to volunteer in their local community. And connected to that, there's a suggestion that this stems from service users beginning to meet new people, generating new interests through participating in those activities, and in themselves beginning to feel more confident. Another emerging impact that was noted by projects, again in line with the grants programme's aims, was that projects had improved their support of service users on a day-to-day basis. So, for starters, the data that we collected from the 3-month monitoring forms told us that to date 193 people from across 11 projects had been helped to access IACT services, with the most common of those being self-help services. And this number mainly concerns projects that had involved IACT providers directly in their work. For example, where an IACT provider had been invited to come along to a drop-in session in person. As part of this, projects had also improved their support when it came to increasing service users' understanding of what support was available to them in the local community. People were becoming more aware and understood more about how they could access what they needed and when they could access it. For example, service users are more informed about IACT services and how to access them. And this had come about as a result of project activities from anything such as projects delivering presentations through to disseminating leaflets, and also focusing on these topics within group discussions. Second, some projects are also putting participants in contact with other forms of mental health support, such as child and adolescent mental health services, organisations such as Healthy Minds, and relevant community groups. And beyond that, a few projects were also signposting towards perhaps services that aren't traditionally connected with mental health, but are certainly linked, such as debt advice services, so services that could help people negotiate stresses that they might be seeing in their day-to-day lives. To illustrate the above 2 points, one project reported that they'd recruited a trained mental health nurse as a community navigator who was now signposting and referring individuals to other services, both mental health specific and more of that practical help, such as filling out complicated forms or even DIY. And when we dug down into this notion of improved support of service users, we also found that one of the main emerging impacts of the mental health grant programme was that at the 3-month point, projects were reporting improved networks and increased joint working between themselves, statutory services, and other community sector organisations. So, as I touched on already, this refers to strengthened signposting and referral processes. So by broadening people's awareness of services in their local area, and also projects broadening their own awareness, they were better able to support their service users when it came to referring them to services of most relevance to them. For example, there's a project that identifies as a Tier 1 service, and they had, through the work that they'd undertaken so far, increased their knowledge of the different means of support that they could refer service users onto who were experiencing perhaps more long-term and enduring mental health issues. Another project also reported that their own staff were more aware of local community partners that they could work alongside and refer their service users onto when relevant. But this was not just a one-way relationship in terms of projects just referring people away from their own projects. It was also reciprocal. And several projects reported how they'd struck up relationships in the local community that meant that more referrals were coming into their own organisation. There's one organisation who had set up a referral process with sexual health clinics in the local area, and those clinics were now referring into that project. There's another project that is running a check-up service for anyone presenting with low-level anxiety or stress at local GP practices, and they have also successfully started receiving referrals. And more broadly than this, projects had also reported increased cooperation at both an operational and a strategic level. So one of the things that stood out to me was one project had said that by being involved with this grant programme and beginning to deliver their project, it actually gained confidence in terms of working alongside the NHS, which was an organisation that they'd always had a little bit of difficulty working with. And on the back of the work that they've done so far, they've just started working with Rochdale CCG. A couple of projects also reported cooperation at operational level. So one project had secured access to a GP database, which actually benefited their own working and the safety of their service users, as it meant that any clinical issues or issues of risk could be immediately reported to primary care. There was no chance of that data being lost somewhere. And finally, this increased cooperation had also begun to foster mutual learning between organisations. There was reports of projects shadowing IAP teams to get a better understanding of the service, and also cultural workshops being run for NHS staff. And finally, perhaps even more broadly than that, funded projects reported that they'd also increased mental health awareness both within and outside of their organisations in terms of the general public. So, first, some projects had reported that their staff and volunteers had increased their awareness of service users' mental health needs. Primarily, this involved organisations running training for their staff. And that was anything from training to understand the specific issues around depression, self-harm, and how to help people build self-esteem, through to perhaps more technical training in terms of different models of healthcare, and then training in terms of almost best practice, so how to support people and service users with mental health needs within more complicated settings such as group environments and group work. For example, one project reported they'd run training for their staff on the different models of mental health care, including the CAMS tiered system, the IAC levels and the Thrive model. And this has helped their staff better understand where peer support sat within those different systems and the different ways in which they could interact with those systems. And as I said before, due to the mutual learning that's been taking place between organisations, projects have also reported an increased understanding within local statutory organisations. So one project have reported that through working with GMMHT staff and IAC providers, they'd managed to increase their understanding of the specific barriers that HIV-positive individuals with mental health needs faced. And then, as I touched on just now, also raising awareness amongst the general public. So there was an art exhibition as part of Manchester Black Minority Ethnic Network during the Manchester City Council's work around International Women's Day. And there's also been discussions held within the local Chinese community in terms of mental health issues, consequences, and causes, so perhaps beginning to address some of the stigma that can exist in different communities. So those are some of the impacts that we're beginning to see emerge from the grant programme, and that was at the stage of 3 months after the projects began to deliver their activities. One of the interesting things alongside that is perhaps thinking about some of the challenges that the projects have encountered along the way, some of the successes that they're proud of, and also some of the factors that they begin to identify as critical to the delivery of their projects. And when we looked at all of the project monitoring forms, there really were 2 themes that kind of stood out. The first was challenges around engaging and involving service users. And I like to break things down into groups of 3, but there were 3 challenges in this sense. So there was challenges in terms of recruitment. So engaging people from perhaps BAME communities due to both language and literacy barriers, and also organisations having limited resources for translation when it came to delivering their activities. But beyond that, again, perhaps encountering reluctance of people to participate in activities due to the perceived stigma that might exist around mental health. Secondly, projects also ran into some challenges around delivery of activities, and I think this is connected to the specific needs that the projects are working with. So projects sometimes experience poor timekeeping on the part of service users, perhaps due to the effects of medication. Some projects struggled with running large group sessions due to group dynamics. There was reports of perhaps limited concentration during project activities over a long period of time. And there was also one report of projects maintaining appropriate boundaries between staff members and service users when support was requested outside of hours. And the third challenge connected to that, and perhaps emerging from that, was about sustained involvement. So working with service users over a longer period of time. And some projects found that often service users would perhaps go through bouts of ill health, and there were challenges about how do you keep them involved and connected to project activities in the long term. But I think this is really interesting. A lot of projects also pointed towards engaging and involving service users as one of their key successes so far. And these projects actually pointed out a number of enabling factors that they thought had worked really well when it came to engaging and involving service users. The first one of these related to creating accessible services. And this included making sure that a service was located close to its target community, making sure that it was affordable for service users, and also making sure that it was timely, that there were no large waiting lists to get involved with a project, that someone could show up and begin to be involved almost immediately. Second, projects reported the importance of creating a supportive environment for the people that came to their door. And the exact nature of this supportive environment differed between projects depending on what services were actually being delivered. But it included friendly and relaxed, informal learning environments that encouraged kind of trust and honesty, trusted environments in which service users felt comfortable to begin to open up and form these connections with other individuals, and also open environments that actually encouraged the participation of service users and made each of their contributions feel valued. For example, one project pointed out that it was important to work with an established community group in a known local community venue when it came to engaging people and receiving their trust almost immediately. Several projects also reported that core service users had played an enabling role when they were delivering their activities, so actually working alongside some of the people who were receiving the service. And this included bringing those service users in to help with recruitment and actually induction of new staff members, and also supporting the involvement and the long-term involvement of wider groups of service users, almost assisting staff in the delivery of activities. The second challenge that was pointed out by a fair number of projects was challenges around working with partners and professionals. Largely this related to project start delays due to CCG restructuring, but also the challenges around developing viable referral pathways with organisations such as community mental health teams. And there are also internal challenges in terms of staff understanding the exact roles and responsibilities of healthcare professionals and how those healthcare professionals could be brought in to help their service users. But again, other organisations pointed towards working with partners and professionals as one of their key successes. And organisations that had struggled in terms of working with partners and professionals also talked about the different ways in which they tried to overcome that challenge. And this was largely in two ways. The first was in terms of improved engagement. So actually meeting with potential referral partners face to face to try and understand the challenges that those organisations are facing themselves within the current political and funding context. Another kind of top tip that was delivered was proactively contacting partners so they themselves could kind of define their role and they could respond immediately to how they could help projects. And a third one was in terms of increased communication about ensuring that there was no duplication of services that projects were running in terms of what statutory services were already running and how the two could be connected. So, for example, there was one project that was really struggling with progressing a referral pathway with a community mental health team. But after raising this issue with Macc actually facilitated the setup of meetings between the two organisations that has now led to a greater understanding and greater working between the two teams. And the other way of kind of mitigating this challenge when it came to working with partners and professionals was also about pursuing diverse methods of recruitment when it came to engaging and involving service users. So seeking referrals from multiple avenues rather than just one, identifying key individuals within local communities who could help engage and involve service users, and perhaps engaging in as much kind of wider promotional activity as the project could do. So, for example, one project discussed that they'd managed to raise the profile of their work through having a presence in their local supermarket, setting up a local market stall, and producing and circulating publicity materials in the local community. So those are some of the impacts and the lessons learned that began to emerge at the 3-month point. And I think what's striking about those little stories and those little examples is actually those almost kind of shoots. Those are the beginning of the stories of change that as an evaluation we'll be looking to follow up on over the next year and come back to you to say, well, you know, you reported this back in your 3-month form. You know, is this a change that actually sustained over a long period of time? Did that increased communication lead to closer working between you and another organisation? And if so, what has come out from that? And so I'm going to hand back to Taryn in terms of talking about what we're going to be doing over the next year of the evaluation.
So in terms of those emerging insights, we are at the moment preparing an interim report which we'll be sharing with Macc, summarising some of those findings in a bit more detail, which we intend to share a short 2-page summary with funded projects. But moving forward from this point, essentially we've got a lot of evaluation activity occurring over the next year. As Tim's already mentioned, we'll first off be looking to ask projects to submit a second project monitoring form, so their own self-assessment of the number of people they've engaged, some of the outcomes which they've seen, and indeed we've received a number of those already where projects have started to come to an end. We'll be supplementing that with interviews with project leads, so asking project leads about their experiences of being part of the funded programme and actually being able to really draw out some of that key learning emanating from the programme. In addition, we're going to be undertaking an online survey of project staff and partners, so actually looking to understand the wider impact beyond the immediate project leads and being able to provide a bit of an estimate in terms of how some of that learning has been shared within organisations and with wider partners. We're also looking to undertake interviews with stakeholders and beneficiaries, so people who have come into contact with the programme, people who have been supported by funded projects, and being able to really get a clearer picture about the impact of the projects on themselves. We'll be bringing all of that together, we'll be drawing all of that together in a final report which we'll be able to publish in January 2019 and share with Macc. So in terms of us being able to pull together all of that information, one thing that's been particularly helpful, and indeed it has been supportive in pulling together this presentation, is hearing from a number of case studies which projects have sent to us. And we really wanted to use this opportunity today to put a bit more of a call out to projects to encourage sort of sharing case studies. Essentially, we've received a number of case studies already which summarise some of the impact which projects are having on an individual level basis. Who are service users who are coming into contact with your project? Essentially, what's the impact been for them? So in terms of what makes a good case study and what really helps us to tell that story from our evaluation perspective and indeed supports the wider work of Macc, there's 3 key components to a case study. Essentially, first of all, being able to explain a bit more about how an individual came into contact with the project. So in terms of what their situation was before they came into contact with the project, how they found it. Supplementing that with a bit of a description of the kind of activities they're involved in as part of the project. What did they enjoy in working with your funded project? What was the benefit of those activities for them? And finally, being able to summarise what's happened as a result. So how did their involvement affect them? What changed as a result of their involvement within your project? And these provide a really nice, succinct way of being able to demonstrate the impact which projects are having on service users in contact with them. It's also great, if where possible, as you can see here, if they can be illustrated with photographs to really bring those case studies alive for us. So in terms of the evaluation going forward, there's a number of key questions which are particularly of interest and certainly which are at the top of our minds over the next coming year, which we're looking to answer. First of all is understanding much more about the components of the grant programme which are working well. We've heard a lot about some of those enabling factors and some of those challenges faced, but we're looking to really draw that out further to inform commissioning going forward. Equally, we're looking to understand how funded projects have been able to influence CCG priorities and raise mental health up the agenda on CCG priorities. In addition to that, we're looking to understand how projects have really integrated themselves and formed new relationships with wider community partners. Beyond that, we're also looking to understand a little bit more detail about how relationships between funded projects and statutory stakeholders have created wider opportunities. What's the legacy of the funded programme, between projects and partners. Finally, we're looking to really think about and understand further the equality aspect of the programme. So understanding to what extent BAME and LGBT groups have been engaged within the programme and are experiencing better mental health care and support as a result of the programme. So those are essentially a number of questions for the evaluation and for us to be taking forward. What we have got in the room with us today is a feedback box, which is just situated over there. It's a red and black box. We'll lift it up and show it to you all. It's a little bit postman packed. But essentially what we'd really like, as you go through the day-to-day and as you do some work in your tables, is just to think of anything that you'd like to tell us as evaluators, or any key questions which you have, which we should be considering in our evaluation going forward, which might come to mind as you work within your tables, as we'd really value your feedback and your buy-in to the evaluation. That's pretty much it. Thank you very much.
Thanks so much.